Well, welcome everyone to the today's webinar. My name is Helen Brown. It's great to see all of you signing in. And we've got people from all around the region. I think the earliest is 6 a.m. to 11 p.m. So thanks for everyone for the commitment. I'm calling in from Curtin University, which is based in Perth, Western Australia. And I'd firstly like to acknowledge the traditional owners of the land on which I sit, the Whadjuk Noongar people. I'd like to pay my respect to their elders past, present and future, and also extend this respect and welcome to the traditional owners of the land on which other participants are seated. I'd like to start today's proceedings by introducing you all to Dr. Marco Martuzzi, who's delivering our opening remarks. Cho, if we could have the slides up now, please. Marco, for those of you who don't know, is the head of the Asia Pacific Centre for Environment and Health of the WHO Regional Office in the Western Pacific, which is based in Seoul. Marco is an epidemiologist with extensive experience in addressing the health impacts of environmental risk factors on both determinants of health and also health equity. In his current role at the ACE Centre, Marco and his team have a strong focus on addressing critical environmental and public health issues related to a range of issues, including air quality, water quality and climate change. He has had a long-held special interest in approaches such as health impact assessment that can support decision-making processes, particularly on health-related matters. So it's with great pleasure now that I hand over to Marco to deliver the opening remarks of the webinar. Thanks, Marco.
Thank you very much, Helen. Thank you for the introduction. And of course, thank you to all people who joined up today. I'm really glad to see we have quite a big group of participants. So thanks very much and greetings from Seoul, Republic of Korea. By way of a short introduction, I'd like really to say that HIA, health impact assessment, especially environmental related issues, is of great interest and of course priority for us. I have one slide. Joe, can you move to the next slide? And of course, for someone like me and many of the people connected today, and certainly all the panelists, HIA is one of the approaches in public health that we are most fond of. It's really one of the best ways of addressing a number of issues in public health that are absolutely essential these days. It's a way of ensuring that health is in the debate of all policies, hopefully at early stages of the debate. It is designed around a model of health that is comprehensive and in line, for example, with WHO's definition. It's very much concerned with vulnerable subgroups and inequalities in health. It focuses on considering the whole picture when you deal with health determinants, not the single risk factors, but the high-level determinants. It's committed to working with stakeholders and relevant actors, and it's really focused on prevention, which, as we know, it's the winning strategy in public health, and many other things. And of course, I don't need to go much into that, because I guess that most of the participants today are well familiar with these qualities of HIA. Next, please. Now, in the Western Pacific region, which we are part of, besides the series of good reasons that I just mentioned for HIA, we have a new reason for working on it and promoting more of it in the region, which is the strategy, the vision that the Western Pacific has in place for the coming 5 years, contained in the For the Future document. It is our strategy for the coming years. And there are many points in that strategy that really are well served by more HIA on the ground. First of all, a special interest for this center here in Seoul, climate change and environment is one of the priorities. So is the vulnerable, reaching the unreached is one of the priorities, so very much in line with the HIA discourse. And the so-called operational shifts in that document, which I really recommend everybody to look at, include things like working in systems, working from the grounds up, and good communication. A number of those issues are really very much in tune with the approach that has been followed for many years now in health impact assessment. So we have this very strong configuration and profile in the Western Pacific region of WHO, whereby the more HIA we're going to have, the better. That's why we're so enthusiastically supportive of this initiative of a webinar today. Next, please. So one of the points that we want to address, the central point in today's webinar is that's all very well. HIA, it's now established as a great resource in public health. We have this mandate in WIPRO, but now this emergency, the COVID-19 emergency broke out, and it is quickly establishing a different new public health world order. Everything has been changing very fast. A number of things have been revolutionized and reconsidered. Therefore, it's the implications on the HIA theory and practice, I would say, are clearly up for discussion and a further round of reflection. And we're going to go through several presentations today, and hopefully a very interactive panel discussion, and we'll invite questions from participants to really address this point, to see where to go next in the HIA discourse in the light of the COVID-19 pandemic. So I'll stop it there, because I just wanted to give you the view from this angle, and I'm now very pleased to hand over to Jean Peralta. She's our facilitator for the day. Jean has more than 40 years of experience in environment and health, and in academic and international institutions. She's currently the coordinator of health and environment in the Western Pacific region of WHO. And she's been involved for some 30 years in HIA in several key roles in both in WHO, Asian Development Bank, and others, and has worked in a variety of roles in more than 30 countries in Asia and the Pacific, both in HIA and also in environmental impact assessment. Jean is very passionate, as we all know, about promoting capacity development and application of HIA, and therefore it's a great pleasure for me to hand it over to you, Jean. Thank you.
Good morning, good afternoon, good evening, everyone. Thank you all for joining us in this webinar on health impact assessment. Thank you, Helen and Marco, for your welcome and the opening remarks and the lengthy introduction about me, I think. Next slide, please. Today, we are going to have a short webinar of 90 minutes, and we have different kinds of people with a broad range of experience on HIA. And we want to welcome all the participants who are all interested one way or another about the potential role of HIA in delivering better health outcomes, particularly in the Asia Pacific region, especially during COVID-19. So as you can see, we will have 4 short presentations, which will provide different perspectives from the members of the HIA Network Asia Pacific. And we are so lucky to have them to share their experiences of their extensive regional and global experience. Afterwards, there will be a question and answer in the forum where Marco will join the 4 speakers to discuss the future of HIA in the region during COVID-19. There will be, at the end of that, there will be closing remarks from Marco. Next slide, please. So we encourage you to use the chat function for any questions or comments, and we will try to respond to them as many as we can. However, due to the time limit, we cannot promise to do so. But this session is going to be recorded, so please know that. All participants will be sent a copy of the slides to be presented, and we will provide a summary of the chat entries later on for all those who have registered to this webinar. Next slide, please. Our first speaker is Dr. Helen Brown. Helen began her work at the WHO Collaborating Center for Health Impact Assessment in 2001, and she then became the director in 2015. She has undertaken extensive work to build capacity in HIA through the WHO Center, including the establishment of the HIA Network Asia Pacific in conjunction with the Asian Development Bank. One of Helen's key areas of interest is the application of HIA to the issue of climate change. Over to you, Helen.
Thanks very much, Jean, for the introduction. Joe, can you advance to my first slide, please? Next. I'm mindful that although many of the participants attending today have got a strong background in HIA, we also have quite a few people who are joining to find out a little bit more about health impact assessment. So I really want to expand on Marco's comments and give you a little bit of a background around the key characteristics of HIA. I like to look at health impact assessment as a systematic and flexible tool or a framework for assessing and managing health outcomes that are generally associated with proposals for policies or development projects or a range of programs. And as Marco has already mentioned, we look at health in the very broad context of both environmental, social, and economic determinants of health. And importantly, we don't just focus on the health risks, which are obviously important. We also look for those opportunities to promote health, to deliver better health outcomes to the community. And we do that in a way that is designed to, I guess, address the widening inequities that are seen in terms of people's health and their opportunities to improve their health. Sustainability is relevant because we are always considering health in the context of not just the current generation, but the future generation. Obviously, a lot of decisions we make around major infrastructure, decisions related to the condition of the environment are going to have long-term health impacts. So it's important we have that view. Democracy is critical because there is a sense that people whose health may be affected by these particular projects or policies have a right not only to be informed of these effects, but also involved. And the key aim of all of these elements is that we use HIA as a planning tool to try and influence decision makers. So the other speakers are going to demonstrate some more information and details about the process. But the key points here were really around those underlying principles of HIA. Next slide, please. I'd like to reflect for a moment on this quote from another document from the Western Pacific region, this health and environment on a changing planet. This quote states that there is a need for HIA, and much like environmental impact assessment, the need to be institutionalised as common practice for both policies and development. And of course, the title of that document also reflects the critical role that climate change has in these discussions. But it also needs to be considered in the context of the huge levels of development that are occurring across the Asia and the Pacific region in coming years. You know, amounts of in the trillions of dollars on an annual basis. And it's important that we start to influence those proposals with respect to health. So I think the need is clear, but if we really reflect on the situation today, I think a lot of us would agree that we're still a long way from HIA becoming institutionalised or considered as common practice. Next slide, please. We considered this question of what these key institutional challenges are with a recent survey to the members of the HIA Network Asia Pacific. So this was a network that was established in late 2017 after some collaborative work between the WHO Centre and ADB. And we've got about 80 members now. And it was interesting to see the leading responses to this question about key institutional challenges for implementing HIA were really centred around this aspect of political will, as well as the limited awareness of HIA amongst policymakers, both within health and in other sectors, and limited governance and policy frameworks to support HIA. And I think that really leads us to start thinking about how can we address this and how can we build capacity in HIA to overcome this. Next slide, please, Cho. So the WHO Centre has been building capacity in HIA for almost 20 years now, and we've come to think about capacity building in this building blocks of three key elements. So the two at the bottom are technical capacity, which refers to things like guidelines and data collection, etc. The knowledge is really all about the people, building skills and competencies. And this is often where we see resources directed in terms of training and development of materials. But the other critical building block is this element of political will, which the survey from the network members indicated is actually a little bit of a stumbling block for institutionalisation of HIA. Next slide, Cho, please. Political will is important because it is this element that ultimately tends to determine the allocation of resources and the implementation of HIA. So whilst we may have strong technical capacity and knowledge, if we don't have the political will, it tends to undermine our knowledge and all our efforts that go into this area. And the political will is really seen as the cornerstone for improving our institutional and legal frameworks. So I think we really need a stronger focus on this if we are going to have a sustained increase in capacity building for HIA. Next slide, please. In terms of the question of the webinar about building capacity in HIA, I'm sure everyone's heard of this term, the new normal, what is going to happen after COVID. There's no doubt it's going to change many aspects in our lives and the way we manage things. And there aren't too many opportunities in our lives to actually have a say in what this new normal might be. What COVID has delivered to us in terms of opportunities, I think, a significant increase in the awareness about the importance of public health, the media coverage that public health is receiving, etc. And this has led to a real evaluation of priorities around what is important and a clear demonstration of those strong connections between health, the environment, and the economy. A risk, I think, is the ongoing challenge of the economic recovery, the health impacts associated with that, but also the fact it's seen as somehow separate to the public health challenges, whereas we should be looking at them in tandem. To build political will, if we have a look at some of the other major public health challenges throughout history, I think it's clear that what we need is a diverse group of actors or stakeholders, but with a clear common message about what's important. And Marco mentioned that importance of communication, evidence to back it up, and importantly, different spheres of influence. There's no one organisation or institute, for example, that's going to be able to manage this on themselves. And that really leads into this aspect of trying to build a strong and competent coalition, and obviously resources to support that. Next slide, please. So I think the opportunities to build this political will beyond COVID are there. I think the first line really is a reflection of the broad range of participants who are here with us today. I think we all need to start questioning how we focus on the political will of the building block. Obviously, we still need to focus on technical capacity and knowledge, but political will is critical. A part of that is stronger advocacy and health voices in the mix. And just start to reflect on how do we shape political will in your own sphere of influence, and how to join forces for this stronger and competent coalition. I think for me and for many of us, there's this sense of urgency about the need to do this, about the need to jointly act on addressing some of these major health challenges. And I think a couple of the presentations to follow are actually going to demonstrate how this political will has been shaped in some of these institutions. Thank you very much, and back to you, Jean.
Now, thank you, Helen, for that very insightful talk. And I would like now to introduce to you Dr. Susan Roth from the Asian Development Bank, where she is presently a Principal Knowledge Sharing and Services Specialist. Susan, he's a medical doctor with a PhD in medical science. She has at ADB led the preparation of the 5-year operational plan for health in 2015. She has been a strong advocate for health impact assessment at ADB and from then until now. She currently leads ADB's Futures and Foresight program and continues to advise on public health, especially in the areas of digital health and health impact assessment. Over to you, Susan.
Thank you very much, Jean, and thank you, Helen, for your fantastic introduction about the importance of political will and political will and leadership, because that's what I can see all my life working with various disciplines. There's one quote which I used when we brought back the health sector to ADB, and this is, health might not be everything, but everything is nothing without health. And I think 2020 is showing everybody that this is true. So I'd like to talk today about our work in China. I'm very glad to see Janice as part of our panel. She is not only a fantastic expert in health impact assessment, but she also became a very good friend and one of the female public health leaders as Jane and Helen. We need to see more of those. So if you can go to the first slide, please. I'd like to first start a bit with the history of health impact assessment in ADB. And Jean has been involved in this for many years. And I think what this timeline shows you also how health impact assessment is changing and how we were able in an institution like ADB to mobilize leadership and political will. From having guidelines on health impact assessment, looking at it from the environmental safeguards angle, and including it as part of our environmental safeguards assessments, it became a topic of its own as part of our health sector discussions, and now it's actually being mainstreamed into urban planning. So this is just one example of the sectors, but I think this is a successful example of how we were able to gain leadership and political will outside the health sector, and how we started to understand that if we work with other stakeholders than the health sector, we need to speak a different language, and we need different tools to engage and to make our recommendations actionable. So next slide, please. And what I found interesting, talking to our urban planners, and we had one very interesting trip to northern China, to the border of Korea and Russia, and Janice was part of this trip. And we had many, as you can imagine, breaks just to get there, and discussions with our urban planner, friend Stefan Rau from ADB, where he said, you know what, I don't really understand it, because health has always been part of city planning. If we go back to the Greek, if we go back to the Romans, if you go back to the Middle Age, if you look at traditional European cities, health has always been an important influence on how cities were planned. And we are like, well, what happened? Why didn't we continue? What's happening now? And next slide, please. This led us to thinking about what do we need to do, especially in urban Asia, to bring back this attention on health in urban planning. Next slide, please. And yeah, I think crucial for us, for our work in China, was that urban planners became aware of the well-being and health issues in cities. And as you know, we see a demographic shift in China. We see also a shift in diseases to more non-communicable diseases. And there was a very important paper by the Lancet Commission on Healthy Cities in China, which I think started to create more awareness among urban planners and public health experts that urban health means more than just having, you know, safe water, air, good air, though this is an issue too in many cities, and basically fulfilling kind of the absolute basic needs. Next one, please. So what became clear then is, especially in our discussions with our urban planners, was yes, they do have an idea of health impact assessment as part of the environmental safeguards processes and so on, but what was missing really a tool that helped to connect between health impact assessments, the recommendations that we make, and the designing in of health features in our urban projects. And this led us to a set of tools that that are probably all familiar to you as health impact assessment specialists, but basically we tailored them to the need of urban planners. Next one, please. So key features of these tools, or of the set of tools, two-phase tools, was really to combine health impact assessment with an urban action management plan, which was understandable for urban planners. Our focus was not just on health, but really on well-being, the broader definition of WHO's definition of health. We wanted to make sure the whole of society and whole of government is included, and we wanted to support an integration of urban planning, management, governance across departmental arrangements in urban governance structures. This also meant we wanted to look at new urban projects. We wanted to look at rehabilitated urban projects, and we wanted to look at existing urban structure. And from the discussions we had with urban planners, it was also clear that we needed to do a lot of explaining on the links of certain urban features and health outcomes, especially related to obviously active transport and diabetes and hypertension and so on. Next one, please. So what we did is we tried to develop a very comprehensive tool, which is inclusive, easy to use, operationally feasible when urban projects get implemented, and which is actionable. And I would love to share our publication with you, but it's not yet out. It will be out in around 3 to 4 weeks. It's a whole book about healthy and age-friendly urban design, where we are linking the practice of health impact assessment with urban design, one of the co-authors was an urban planner. So, and Janice was also involved in this. So, so we hope that this will help, especially urban planners, to understand how to design in health measures. Next one. So now you're probably excited to see what exactly are we doing? What is this tool? And you'll see it's really not rocket science, okay? It's really more about how we communicate what we are doing, who do we involve, and how do we create a very structured, actionable process. So the first part is really about preparing the health impact assessment and ensuring we establish an interdisciplinary and cross-sectoral urban health team. So it's not happening in isolation. We are looking obviously at the health risk, but also at possibilities to enhance positive health impacts. And this health impact assessment is then followed by a healthy, age-friendly city action management plan. Sounds complicated, but what it basically means is we are looking at birth to end of life life cycle of urban populations, and are looking at actionable measures in urban planning processes. We are also ensuring that there's financing, there's clear implementation available, and that there's monitoring and evaluation, and that there is a governance process where the mayor or the highest level of the urban government is accountable and shows this kind of leadership. Next one. So as you can see here, interesting feature is also that we are looking at retrofitting existing urban areas, and then we are looking at health and age positive urban development projects. So we want to basically brand them already as health and age positive. One interesting development there is also that in our public-private partnership unit now, where they're looking at financing of urban projects, they are also now actually looking at economic impacts of healthy design of projects, so that we would be able to help urban planners prioritize those urban projects which actually have positive health and age outcomes. So this is another interesting development, I think, that we see in the Asian Development Bank. Next one, please. I think let's step over this. You'll see the slides. I think this is a bit too detailed. Next one, please, for this discussion. But basically, all of this will be available in this publication that is coming out very soon. And you can see here that this very simplified step-by-step approach, which we developed and also tested in various cities in China, really helped to get non-health experts on board and create an implementation mechanism and an accountability mechanism. Next one, please. So I want to talk about two examples. And again, in both examples, Janice was involved. So unfortunately, I will have to leave a bit earlier, and Janice will be able to stay on, so she'll also be able to answer some of your questions. One was a border urban development project in the Yunnan-Linkang Regional Cooperation Integration Area. It's the border between Myanmar and People's Republic of China. And there we did a rapid health impact assessment to assess health risks related to infectious disease, road safety, wildlife trade, and so on. So it was, to be honest, was a bit the classic approach, rapid health impact assessment. We had a little bit of an opportunity to inform the design of the project, which will include a management plan during the implementation, but we didn't really have that real anchor and leverage to do a bit more. So in the next project, next one, please. In the next project in People's Republic of China, we did it a bit differently. We first built the leadership and the political will of our team leader, who is an urban health specialist, and got him really excited about it. He had been involved in healthy design, healthy urban design before, so it was actually easy to win him as a champion. And then we were able, through him, to also convince our urban planning counterparts and urban government counterparts in Yanji to consider health aspects of their urban design. So what we basically did is we did a baseline assessment of the health determinants and risk and adverse impacts of the project. And then we designed this management plan to control communicable diseases, but also significantly reduce non-communicable diseases. Yanji is a very orderly city in China. It's very clean, actually. It's also a tourist destination. And the challenge they have really is more about aging population, non-communicable diseases. So we wanted to build in features of, as you can see, green spaces, open spaces, active transport, and awareness raising about determinants of health and environmental influences of health. So this project is now being implemented. It is, especially now, it's challenging, to be honest, to continue that kind of ownership over those health features. Sometimes, as you can imagine, being very results oriented in terms of, you know, designing the traditional urban features and getting contracts out and so on, is higher on the agenda than these, what we call them, soft tools. But this is where we really need all of your support and your political engagement and leadership to push for these features. And I'd like to end with this quote. And I think this is what we need to be reminded of every day. If you don't use your positive power for change, you are indeed part of the problem. So we should never give up to push for these features, to push for health impact assessment, and to make sure people remember that it is about health. And we can see in COVID, where urban centers were the hotspots of the disease, that we could have probably avoided many of the negative impacts if we had open spaces, if we had clean air, if we had decentralized health systems, and if we had better health education. So with that, thank you very much, and over to Jean again.
Right. Thank you very much, Suzanne. Suzanne was our fearless leader of HIA at ADB when we all were there working. Thank you very much for this interesting demonstration of how ADB is integrating HIA into very important projects such as what you have shared with us. Thank you. I'd like to encourage everyone to continue providing your comments and your questions in the chat. And that for those who came in late, we are going to share all of the presentations and the slides to you with some chat summaries for all of the registrants. Now, I'd like to introduce our third speaker, Dr. Martin Burley, who has over 30 years of HIA experience worldwide. And as what Suzanne has shared, he wrote the 1992 HIA guidelines at ADB and also the 2018 HIA source book. He has written many books and guidelines and has been a reviewer of many others. He was instrumental in bringing the discipline to the UK and set up the Liverpool Health Impact Assessment Consortium in 1997. He also co-founded the HIA section of the International Association of Impact Assessment, as well as its annual HIA conference. He has been a consultant and advisor to many organizations, such as ADB, WHO, World Bank, and many private companies and governments. Over to you, Martin.
Thank you, Jean, for that introduction. Can we go on to the first slide, please? Okay, so we've been hearing about what health impact assessment is, and of course many of the participants already know that, and for some it's new. And I would like to just summarize it in this way, as it's a tool for scrutinizing future policies and plans. And from my own point of view, the interest is mainly outside the health sector. And as I've been watching this pandemic develop, I've been feeling more strongly something that I'd been feeling before, that health impact assessment is about the perceived and not perceived health risks and benefits of projects and policies. And one of the first steps, in my view, of health impact assessment is moving things from not perceived pot to the perceived pot. So we end up with a lot of perceived risks and benefits. And When we've done that, we're faced with the challenge of prioritizing them. So let's go to the next slide. Right, so in health impact assessment, there are a number of tools available for establishing the priorities. And the one that we hear about most often is to try and determine what the likelihood and severity is of each perceived risk. And this is a kind of logical process. It makes a lot of sense. But the challenge we face, I think, is that when people look at risks, they don't use logical processes very often. We're more likely to think about things like, how close is it to us? Are we personally involved? Is it a risk which we're familiar with or not? And then there's this whole set of challenges which are known as the cognitive biases, which have been written about extensively. And then there's the societal preferences, which may be quite different to the priorities that I would perceive as a health impact assessment practitioner. And I wanted to make that point with the next slide. Right, this is a severity likelihood matrix which was developed in the UK at national level. It's called the National Risk Register for 2012. So it kind of tries to look ahead and say, what are the big risks that the UK faces in the future? And you can see there in red that 3 kinds of communicable diseases are high up on the list in both their likelihood and their severity. And alongside them, you can see a range of other kinds of risks. And I haven't included all the ones that are on the risk register, but just some to give you a sense of what it might look like. I was particularly struck by the one called major industrial accidents, because there was such a thing recently, as many of you will know, in Italy. And I was thinking about how that fitted in with this, what it can look like. Let's go on to the next slide. So once we've established which risks we want to prioritize, but by no means an easy process, but no time to talk about it in more detail now, then we have to consider how we're going to mitigate it. And there are various principles that apply when we consider mitigation. By the way, you can see I'm focusing more on risk than benefit, and that's just because I don't have time to do both in this short talk. So we have something called the mitigation hierarchy. And that says that, first of all, try and mitigate your risks by changing the design of things. After that, consider how you can change the operation of things. And after that, think about how you can include personal protection. And after that, if all fails, what sort of medical treatments needs to be available in order to put people back together after a risk has made itself manifest. And underpinning that, again, there is processes of insurance. So we have this concept of a hierarchy. And if we apply it to the pandemic, before talking about the pandemic, I would like to suggest that the ones I've highlighted in green are the ones that are primarily of interest to health impact assessment. And then the ones below that are primarily of interest to the medical sector, which we often call the health sector. So in terms of something like the pandemic, we can imagine, how do we change? Whoa, go back, I'm finished. Thank you. I just wanted to talk there about what that might look like, changing the design of things. Example, so in an urban transport context, changing the design of a city to make it more healthy might include putting in good quality bike lanes so that people feel confident about cycling and can get out of their cars, get some exercise as they move around the city. That in the urban context is considered very important for health. In the context of a pandemic, it seems to be about how are we going to reduce the risk of zoonoses, and a very obvious part of that solution might look like switching our diets into more of a global plant-based set of diets. But where that can't be done, we have to think about operation, and in the context of a pandemic, that might be about how we regulate markets. And then we get down into the more medical things, many of which we've personally been engaged with in the pandemic, such as wearing face masks, such as social distances, such as sanitizing. And then, of course, when all that fails, we end up in the emergency room and go on a ventilator. Okay, so that's the mitigation hierarchy. And one of the important concepts to do with mitigation hierarchies is you don't try and do just one thing, you try and do a whole set of things, which we call multiple barriers. Right, let's go on to the next slide. Next and last slide now, please. Thank you. So when I kind of think about design and operation as the main interest of health impact assessment, and I think about mapping that onto all the sectors of development, and then thinking about what do we need to do about pandemics, then I have to throw that out to the audience, say, you're the experts, please, can we all get together and find a way of filling in this mapping? There are many things we do know about that we can do. And obviously something like on water supply there, we can make it easier for people to wash their hands more frequently. And there are many things which we haven't yet thought out. And we need a lot of expertise from a lot of people to fill in that table. And that's why I throw it out to you, the audience. Right, I think that's the last slide, but just let me remember. If you just go on one. Yes, we don't need to look at that. That'll be in the collection of slides. So back to you, Jean, and thank you for your time.
Thank you, Martin, for your practical suggestions on how the HIA framework can be used to consider and manage issues such as COVID-19, the pandemic. I'd like to introduce our final speaker for today, Dr. Janice Chandra. Janice has been with HIA and community health for many years, having been a practitioner and researcher extensively working in Asia and the Pacific region. Janice leads a research program in Canada focused on Indigenous health surveillance systems as part of the HIA process. She also led the development of an innovative HIA framework to manage worker and community health and safety risk in economic zones in the Greater Mekong subregion. As you might have heard, she has been mentioned a lot by Suzanne in her presentation because she has done a lot of collaborative work at ADB. Over to you, Janice.
Thank you, Jean, and welcome everybody. Today I'm calling in from Parksville, British Columbia, Canada. So that's on the western side of the country. And I'd like to start this presentation by first acknowledging some of the communities that I've had the opportunity to work with that has shaped this presentation, specifically Kitsillis First Nation. They're a small Indigenous nation in Western Canada of approximately 700 members left on this earth. And so it's through that lens that I'm hoping to explore a bit of a deep topic, to be honest with you, in about 7 slides. So I welcome comments after, connections after, to explore this conversation a bit deeper, because really when we think about health impact assessment, especially as it relates to Indigenous people, we need to acknowledge certain vulnerabilities and also specific rights. So with that, Cho, maybe we could progress to the next slide. Thank you. For those of you who are interested, we actually do have another guidance available for conducting health impact assessment with Indigenous people. That's available on the Asia Pacific Network, HIA Network. And you'll notice I've underlined the with. And sometimes when we conduct HIA, it's often for. It's for a project, it's for a government. But when we look at health and when we are working with Indigenous people, we advocate that actually we do this in partnership. We need to do this because we need to undertake a unique approach. Each Indigenous nation globally will have a set of historical legacies that influence their health and well-being. And it's important to understand that alongside with them. That requires trust, open communication, transparency, and a lot of listening to not just words. We have to think about the unique determinants of health that Indigenous people hold. We advocate strongly that the strongest determinants of Indigenous health would be access to traditional territory, access to traditional foods, and resources. And that's much different than what we would think about for the general population. We know that there are unique ways of knowing and knowledge holders, and the way that scientific processes are understood and explained can be unique. So this is also pointing why we need to do this together. Two final points here is specifically in Canada, but many places around the world, like the Philippines and other places with rich Indigenous people and diversity, there are very specific rights for Indigenous people, especially around the collection of data and research, which HIA, of course, is a part of. And finally, and last but not least, we see that there are unique priorities. When you think back to the first opening statement I made, we're talking about a nation with 700 people left on this planet. So their priorities will be much different than ours. Next slide, please. So as you see here, we talked a lot about health impact assessment, and as part of the guidance that we've put forth over the last few years, you can see that the HIA process is very much similar to an environmental or a social impact assessment process. There's set stages, but we do advocate that this needs to be cyclical in nature. Community health, safety issues, as you know from experience in COVID-19, is an ever-changing phenomenon. And we really need to keep this momentum going and not just make it a linear assessment, a one-stop shop. That surveillance, that monitoring should trigger a response to undertake further risk assessments if conditions change. And we may need to shift our management measures accordingly. Next slide. So this is part of the approach we take in conducting health impact assessment with Indigenous people. And actually for Kitselis, the one nation that I had mentioned at the beginning, we undertook an HIA with them in 2019 in light of the construction of a $40 billion LNG facility and a $7 billion pipeline associated with it. In addition to that, they had over 20 other industrial projects affecting their traditional territory. And the leadership at that time jumped right in. And actually the initiative sparked a momentum within the community where we all agreed that we would make health and safety a part of our everyday life. And that's the vision for health impact assessment for this nation. Next slide. And I share with you a few of the health conditions from the baseline study that was undertaken as part of the work. And I'm shifting your attention now, if we can start to think about some implications around COVID-19 and where we stand. So this baseline actually was taken and updated in February of 2020. So right before the lockdown for COVID had actually hit Canada, which was March 16th. You can see here cardiovascular disease, diabetes, respiratory illness, mental health issues, a lot of conditions where households are reporting at least one person having these health conditions, which of course predisposes them to a vulnerability for negative COVID-19 outcomes. So this becomes important to frame. Next slide. In addition, and you can see a visual of the community here on the right-hand side, we also see that in these houses, we actually have multiple generations and multiple families. On average for the study, we had at least 2 families per household, but in some cases we had up to 5 5 different family generations in a household with 12 people. Also, just for your interest, you know, the demographic representation of an Indigenous population in Canada, like many other places in the world, is much reversed than what we would see in North America or Europe. So we have a larger percent of the population being younger, a very small percentage being older. And this also speaks to vulnerability because these are the knowledge holders. These may be the only people that speak fluently the language, which is so important for that cultural transition over generations. Next slide. And so I noted there was actually a couple of questions around COVID-19. How does emergency response link to health impact assessment? And actually, in the case for this Indigenous community, while we didn't anticipate COVID-19, we had set up the assessment that it would be cyclical. Lucky for us, in this case, we were very adaptable and malleable to deal with the COVID-19 scenario. And right now, we have not had one positive COVID-19 case for this nation. That said, there has been a number of issues that did emerge. And if we can think about the Canadian and international protocols for COVID-19 being developed for the general population, not really for a population where there's only 700 people left on the planet. There's a lot of stress on the Emergency Response Division for this nation. In addition, we had a case where supplies were unavailable. So for Canada, it was regulated at one point that masks were to be worn. And yet this nation had no ability to receive or acquire such supplies. We've also dealt with isolation challenges in the case of if there is a positive case. Since we have multiple generations and multiple families living together, how do we manage that? And that's taken a whole new approach. And finally, last but not least, you know, just today I got off a call with industrial partners in the area, prompting them to review their COVID-19 protocols, as they have some of the elders and knowledge holders for the nation working on their projects, and they have had positive cases in their workforce. So I guess I'd like to say as a closing statement, our process for health impact assessment that we advocate strongly for these days is really following that management strategy of plan, do, check, act, or adjust as needed. And I'm very passionate about that. So thank you so much for your time today. It's been a pleasure to speak with you. Thank you, Jean.
Right. Thank you very much, Janice. That very, very deep sympathy for all of these Indigenous peoples. And I'm sure they are found all over the world. The 4 presentations actually gave us a lot of discussion points for the forum. And we also had a lot of questions sent earlier and comments via the chat. So I'd like to open the forum now, and I could see that Suzanne has to leave later, so we'll probably give her some priority if she's still around. Okay, so we have, if I may start with the first question. We know that there are many stimulus packages to support economic recovery from COVID, and this will lead to many large and small-scale development projects across the region. How do you think can we promote stronger consideration of health outcomes of these projects? Can we ask Suzanne first to give the first response to this question? Suzanne?
Yeah, thank you, Jean, for giving me a few minutes before I have to leave. I think it's very interesting. I had several discussions with our environment and climate change experts when this pandemic started, and I asked them, do you see this as an opportunity for change to drive clean, climate responsive investments? And from the beginning, they're very doubtful. They said, well, the problem will be the money. It might not be available. There's still the understanding that doing things differently might cost more. and still we are driven by, you know, obviously the economics and how to bounce back economically faster and so on. So I do believe the development organizations like WHO, ADB, and so on have a role to play to stimulate this agenda on green recovery and doing things differently. And it would also require a change in our portfolio and probably more drastic considerations, what we finance, how and how we engage. This is probably easier said than done. I would love to hear from WHO, from Marco, what he thinks. Another interesting discussion is if we now have these green recovery packages and so on, understanding how is this money being really accounted for, where is it going to, and there are some interesting groups now who are doing artificial intelligence enabled tracking of these kind of expenses and also expenditures, and also seeing if it goes into green recovery. So I'm not on one side or the other. I think we all have collectively to do a lot more work to enable this kind of green recovery and thinking differently and doing changing business as usual and really seriously bringing health at the center of the political discussion. I am a bit worried about now the quite mechanical approach to solving the pandemic, which is now driven a lot by the vaccines discussion, which no doubt about it is important and we need it. But so do we need to understand really population community risks. And I think Jenny's analysis of where the underlying health conditions are important. What we see is that the COVID burden is actually revealing a really bad health conditions of people and bad living conditions, and that's another point we really have to consider. So hopefully through this network we'll see all your leadership to drive this dialogue and insist in the kind of health-centered green recovery.
Thank you, Susanne. As you have pointed out, perhaps we should listen to what WHO has to say. So Marco, would you be willing to share your thoughts on this question?
Yes, thank you. Two things. One, when it comes to the point that Susan raised about positioning WHO, I'd like to just draw your attention and everybody's attention to a very nice document that WHO published recently, the manifesto for I can't remember the title, like COVID reconstruction or something, which includes very bold statements and very, from my point of view, very, I fully agree with those. One, for example, just to give an example of these statements, one is about stopping taxpayers' money to subsidize fossil fuels. So these kind of statements are I think, very important, very bold, and I think WHO putting his weight, full weight behind it. It's a very important development, which I certainly fully support. Second point, more closer to the practice of HIA. Now we're looking at these stimulus packages. Very often the issue is framed with a conflict, a tension between health and economy, unfortunately. Whereas a better framing would certainly benefit the discussion. However, in HIA, in my experience, there's often a little bit of ambiguity as to using and how to use economic assessments, assessing the economic dimension of health impacts. I don't think it's possible to say whether it's a good idea or not. We did a bit of work in the European region in previous years on this, and I think there's a very strong methodology nowadays available. There's also, I think, a very mature reflection. my main point is that although I don't think it's easy to say, do or not do economic assessments, sometimes the issue is kind of swept under the carpet, and it might be good to bring it out and make sort of conscious and explicit decisions about whether or not such type of assessments and instruments should be used, can be used in HIA and environmental assessment. Over.
Okay, thank you, Marco. And the same question about stimulus packages and any consideration of health outcomes of these projects. Maybe I should ask Janice in relation to reaching the lives of vulnerable people and groups in these stimulus packages. What do you think?
Jean, I think this is a very important question. And, if I can place the private sector hat on for just a moment before we get to populations that are vulnerable, I think we're seeing that today is a different day in which we will conduct business. And I think there's a lot of champions out there, even scrolling through the attendees that are here today. There's a lot of champions online today for this, this forum, where this is becoming a business and health safeguard imperative. So we need to be thinking about those health outcomes in those stimulus packages. We can't ignore it. It's not just for COVID. And I think some of the learnings and leadership WHO has had, especially around the climate change, environment, and health agenda, has demonstrated that we need to be prepared for what's next. And so I do think that health will come through. And if we don't do that, we are doing a disservice to Indigenous populations, to vulnerable workers. We're not addressing some of the root causes, such as basic water, sanitation, and hygiene in healthcare facilities. Thank you.
Thank you very much, Janice, for that response. We really have to go now to the questions from the chat group. There is a question here. There is a clear divide between emergency preparedness and HIA, and as this is being raised for unplanned emergencies, and how can HIA as a systemic development planning tool can be used for emergency preparedness and the interconnection of HIA. I don't know who can respond to this from the panel, but maybe Helen or Martin. Martin, you mentioned something about emergencies and pandemic and what we are or not doing anything about it.
Okay, thank you. I think this question came from Robert. In my mind, there are already processes for looking at emergency preparedness that are separate to health impact assessment processes. And we don't want to reinvent the wheel. Similarly, there are processes for looking at occupational health and safety that are different to health impact assessment. So health impact assessment is positioned with some overlaps between these other processes, and the real challenge is to explore that overlap, decide who takes responsibility for it. And that seems to me to be an organizational issue, and it certainly needs to be addressed.
Okay, thank you for that. Another question, if I may read that, is a question about bike lanes or sidewalks in Asian countries. The climate is hot and humid, which becomes a huge deterrent for walking or cycling to and from places. How would you suggest to improve the urban design to increase physical activities, taking into account climate? So maybe Martin or Helen can respond to this.
If I may, because I'm very keen on this one.
Yes,
I'm sure everybody else would like to say something too.
Yeah, but I know you have that in your slide. Yes.
Yes, I had it in my slide. I'm a very keen cyclist. I'm a very big promoter of active transport. And I've been looking at this issue in all sorts of hot climates. I initially started focusing on it in the Middle East, where you have cities in deserts, which are clearly very hot. And what you see there is traditionally, of course, people built narrow streets, so there was lots of shade. And then we have modern cities which have no shade and wide streets. And what's more, what I observed there is that when people park their cars in the Middle East, they always are able to park them under shade. They put up artificial shades just for the parking of cars in lots and lots of places. But if you walk down the sidewalk, there's no shade at all. So simple things like having a shaded sidewalk would help. And that's just one example. And of course, you can't do anything about humidity very much, but you can shade people.
Yeah, so I'd
Helen,
add
please,
something.
yes.
Thanks, Jean. I'd add something there. I mean, I agree with Martin. It's about designing the cities to try and take these things into account. So Perth, whilst it's not humid, is very, very hot. And we're faced with the long distances as well, which is an issue. And so one of the ways that this has been addressed is by even developing better combinations of public transport and cycling. So there might not be necessarily an option for someone to travel the whole way, but there's good facilities to travel part way in public transport, and there's also good end of facilities. So, you know, showering and being able to kind of freshen up at work. And as well, another thing that's happened even at a university level is that they've really increased the cost of parking and made much more kind of financial incentives for cyclists. We have cycling workshops, people can have their bikes serviced for free, we have secure deposits for bikes, etc. So it's really just about innovations to try and take care of the unpleasant aspects that might exist, but also to provide incentives.
Thank you, Helen. The next question is, does HIA need to change or evolve as a consequence of COVID-19? I don't know, Marco, Martin, Janice, you know, anyone raise your hand? Do we need to change the way we do things about HIA because of COVID-19? Okay,
well,
Helen.
Jean, if I may,
Oh.
no, please go ahead.
Okay, Helen first. Right. Helen?
Okay, yeah, so I think
then Marco.
One of the things we need to change really, I think, relates back to the comment that, that both Suzanne and Marco made, which was how to kind of convince people of the value of doing a health impact assessment, and this tendency to see the consideration of health as being an additional cost, as if health is just a cost, not an asset. And so I think if we had a look at the bringing in a more economic assessment, and in some ways I think this is part of our struggle to really go to this so-called triple bottom line that we've been speaking about for years, and yet we're still questioning whether we should be looking at the long-term economic aspects as well. So I think for HIA that is an important aspect, and I think as well, just building off the back of COVID, demonstrating what this small virus, the impact it has had on the economy. And so I think that is a very good demonstration of why we should be building in those economic factors to HIA. Thanks.
Thank you, Helen. Marco, please.
Yes, I fully agree with that. And of course, this is the question of the day, I think. Simply put, I mean, everything is changing, needs to change in the light of COVID, so HIA is no exception. But on the other hand, I think Martin also expressed it, that the COVID is making a number of things more evident, more pronounced. But if you look at the HIA approach and practice and philosophy, let's say, a lot of the things that are becoming now so acute had been addressed and discussed before. So maybe it's a matter of evolution rather than revolution for HIA. But ultimately I see that there's a lot of space and need for strengthening HIA to address the COVID-related impacts and issues. But in a rather, I see some continuity in what the HIA community could be engaged in. So it's a lot of more, and some of it is more of the same, and a lot more. Thank you.
Thank you, Marco. If I may read another question,
Jean,
COVID-19. Oh, sorry, Janice. Janice, please.
I wanted to add in 2 statements, because actually as a practitioner, I'm faced with this exact situation. I have a small indigenous nation of 120 people that live on an island on the coast of British Columbia, and they want to implement a community health and safety monitoring program. And of course, the prior stage is a health impact assessment. And we've had to be innovative. We've had to, what I would normally do to do a scoping phase visit in community, we've had to take a different approach to getting to know the community, to understanding the layout. We've had to spend a lot more time training, our local partners to actually lead this assessment work. And so I would say from a practitioner's and just a process perspective, we've had some major shifts that have happened, but you have to be, it allows for innovation. So it's not a deterrent, it's an opportunity.
I think so, exactly. Hence, we are having our virtual meeting and online meetings, even public consultations in safeguards now in HIA. Are really challenging, how to consult the people and how can they participate because of COVID-19. Thank you, Janice. Now there is another question here about COVID-19 has clearly demonstrated the need for multi-sectoral approaches to assess and manage potential health impacts associated with many activities. What role can HIA play in facilitating greater engagement and cross-sectoral collaboration to deliver better health outcomes? It's a bit long, but anybody who would like to respond to this? Martin, Janice, or Helen?
Okay. So I think that we've learned a great deal about intersectoral collaboration over the last 30 or 40 years that we've been struggling with health impact assessment. And I think one of the issues that I've observed, one of the key lessons is that we have to engage with the other sectors on their terms, using their language, understanding their priorities. We mustn't expect the other sectors to engage with the health sector on our terms and in thinking about our priorities. And we've also learned that there's a great deal of difference between the formal and the informal networks that you can establish between sectors. So you can have memoranda of understanding that ask other sectors to communicate with the health sector about these things. But in addition to that, you have these informal sectors, informal networks where people working in one sector feel that they know somebody in another sector sufficiently well to ring them up and have a chat with them. And we put a lot of work into trying to develop those informal sectors.
Okay, thank you, Martin. Janice, please.
I think I'll say a short statement in support of Suzanne's presentation, and that when this guidance comes out for urban planning, I think this is a great resource in terms of drawing together the different sectors that lead to urban health outcomes. So there might be some insight in that, and as well the guidance on special economic zones. That framework was built upon the need for a multi-sectoral approach to manage the risks associated with economic zone and industrial zone development and operation. Thank you.
Okay, thank you, Janice. I want to get this is quite a, sorry. Is anyone still raising a hand or no? Oh,
yes,
Helen.
I just wanted
Okay.
to say something quickly
I'm so
about that,
excited,
Jean.
Helen. I'm sorry because there's so many
Well, that's
questions.
okay.
Okay.
We'll get through as many as we can.
Right. Okay.
No, I just wanted to comment on a couple of things about the importance of multi-sectoral work, and I did like Suzanne's comment in her presentation about looking at things through different angles, and this is really speaking to what Martin was saying as well. And in some ways, I see that as there's that expression of getting your foot in the door and just talking about health all the time. And one of the things that we do quite often is provide commentary on discussion papers that are put out by other sectors. So there was one recently in WA, the infrastructure strategy for the next 20 or 30 years. They did a number of scenarios, and what struck me about the scenarios, there wasn't really much talk about people or health in them. And so we put in a submission, and we've now started a little bit of a dialogue with that sector. So Martin's right, we can't assume that people who are sitting in other sectors who have different skill sets, different training, a different job description, are going to have, health just pop into their mind as something they should be considering. It's really our role to be getting out there, out of our own little health bubble that we can sometimes be in, and influence these other sectors and show them a way that you can approach it, which is obviously through tools such as HIA.
Thank you, Helen. This may be the last question that we could take in, but rather deep question. What are the next best steps to help drive this work forward? And how can we work collectively to take action? And what are the biggest gaps in local and regional data needed for HIA to fill those gaps, especially now during COVID-19? And of course, what is the one thing at the end of the day that we can agree as a priority in terms of next steps and how we can all join together in doing this? This is quite challenging and maybe a good ending to our discussion in this forum. We may not have the correct answer now, but it's something to think about. But if any of our panel members can say something, please. Janice?
I'll keep it short so everybody can add to that, but I have had the most inspiring half decade of my professional career working in the Asia Pacific region. And I strongly believe that if we continue on the path of capacity building, advocacy, outreach, just passion for this topic in general, we will succeed in pushing this agenda forward, because we have made tremendous milestones. And for that, a huge congratulations to everybody that's on this panel today for that leadership. Thank you.
Thank you, Janice. Helen, please.
Thanks, Jean, and you're right, it is a very big question. And I think in terms of moving it forward, and particularly with this concept of increasing political will, I think there's a reason it's often underdone in capacity building, and we focus on training and knowledge. And it's because it's difficult. There isn't a simple kind of easy solution. But on the other hand, the responses are around advocacy, are around organising. And I think for example, from my own personal perspective, the HIA Network Asia Pacific has got some really good membership across ministries of health and environment, development banks, consultants, etc., etc. So I think we have the starting point for a better communication, but I think we have to start getting together and being a little bit more strategic about developing a common message and communicating with other sectors. And so to kick that off, I guess one of the things that we'll do as a result of the webinar is we'll take everyone's comments on board and develop a little bit of a report that we'll send out to not just the people who have attended today, but there was also a large number of registrants from WHO country officers around the region, from organisations. So I think really a call to action from all those people.
All right. I think this ends our forum, and in keeping with the time, I'd like to ask, thank you all panelists, and Suzanne sends her apologies that she has to leave because of some meeting with senior management, but I think we appreciate very much the panel members for their insights and the contribution to this webinar. May I ask Marco Martuzzi again to give the final remarks to this webinar?
Yes, with pleasure. Thank you very much, Jean. And of course, everybody else. It's been a very stimulating discussion, I think. And it's also been great to see this high level of interest. We had 130, 40 some moment participants. And in my recent experience with webinars lately, this is a quite high number, higher than the average ones that I attended. So this reflects, I think, a high level of interest, which is great, of course. So thanks again to everybody who connected. These last questions about how to do next is really where we wanted to go, and we collected a number of suggestions on that, which I will not try to summarize, because there's been so much that we'll need to certainly work on the recording, the points that we collected today, and of course get back to everybody and make this kind of information available. I think in any case, this discussion, both at the general level and at the level of what implications of COVID-19, demonstrates once again that HIA has come a long way, has come of age really. Today we've seen examples in many domains, in the urban planning, for example, that it's an area that's been addressed by HIA for many years, that really show a high level of maturity and ability to make a difference on the ground. We talked about political leadership and will, and that's one of the, maybe not prerequisite, but certainly very important drivers for HIA. I think, of course, many issues are still open for debate. We refer to the need of stronger and closer dialogue between, let's say, the HIA community and the other parts of the health sectors, maybe more focused on the healthcare side of things. We remarked some important reality checks on the ground, the work with native communities, indigenous communities that really put the HIA community in front of some very important demands and issues on the ground, but also offer the opportunity of addressing new ways of working. And there was this question on data gaps. I'm a bit sorry we didn't have time to address it. It's a very difficult one, which certainly needs a lot of attention. And on the part of the WHO, of course, for us, it's important our interface and dialogue with countries, especially at the level of Ministry of Health, which is the natural counterpart. And in our case, here in Seoul, also Ministries of Environment, which often are those who have a lot of relevant data and information. So all of this, I think, makes a rather rich, sometimes complicated picture, but also highly encouraging. And I think certainly today's discussion was very rewarding, I think, for all of us, very useful. And we definitely look forward to these next steps, which we will try to push on with, also stimulated by today's discussion and reflections. And with that, I think we can bring this webinar to an end. And I'd like once again to thank everybody, panelists, participants and those who asked questions. And sorry that we didn't have time to to address all of them, but we'll try to make up with that in the near future. Thank you very much and have a good